Welcome to Cancer 101. You may have heard the term adjuvant therapy, and we're going to talk about that today, including another term, neo-adjuvant therapy. And these are often confusing to cancer patients. But to explain this, let's start with the primary treatment. The primary treatment in cancer is often simply surgery. A lot of patients miss the fact that their main treatment is the surgery they're going to get or have already had. They laser focus on the follow-up therapy after surgery, typically chemotherapy. There may be a number of reasons that they do that. They often think of cancer treatment as focusing around the maybe 6 months of chemotherapy they get, the side effects of chemotherapy, and so forth. But in fact, the primary treatment, where you get the most bang for your buck, is surgery. So what is chemotherapy or other types of therapy like radiation therapy? Well, in general, those are called adjuvant therapies. Adjuvans in Latin means help or help reaching a goal, more specifically. And so if your primary treatment is, say, surgery, they may want to just stop there. Or they may want to add adjuvant therapy. Adjuvant therapy can be anything: chemotherapy, hormone therapy, biological therapies, and so forth. And the idea is that while the primary treatment, surgery, really gives you the most effect in terms of your overall survival or your 5-year survival, whatever it happens to be, the chemotherapy will then hopefully add an additional 10 or 20% survival onto that. And so basically, those adjuvant therapies, as they call them, that follow up the primary treatment, are simply to try to improve by a number of percentage points based on many clinical trials over the last few decades that have shown that by adding a therapy like chemotherapy, hormone therapy, you will do better overall. So what then is neo-adjuvant therapy? Well, typically, that will be used in a situation where the tumor you have is a little bit too big, and they want to bring it down to a more manageable size so that the surgery, which is the primary treatment again, is more successful, or hopefully more successful. So what they will do then is possibly give you chemotherapy and or radiation therapy alone. And the hope is then it will shrink the tumor. It'll make the surgery less complicated because they're dealing with a smaller mass, and they will be able to do a more successful surgery for you. And so that's the meaning of neo-adjuvant. Neo, of course, means new. In this case, really what it means is instead of the treatment being a follow-up treatment to surgery, it's a precursor to surgery in order to aid that surgical intervention. So basically, that's a definition of terms today. If you're in that situation, hopefully this clears up what the doctors are talking about. We'll see you in the next video.